I'm Brad Thomas. I'm an orthopedic surgeon. I specialize in sports medicine. I have a private practice community-based, primarily sports medicine, orthopedic surgery, and I'm also the chief of sports medicine at Harvard UCLA, where I instruct residents. The operating room is a cold environment, but there are some issues related to heat stress. Any particular case, whether it's a total shoulder replacement or just even a difficult arthroscopic case, if you're struggling during time of surgery, certainly the stress of the struggle, in addition to the physical aspect of the work, can cause some perspiration. So I have been using both the Rite Temp surgeon's vest and the disposable surgeon's vest, and I find they're both great. I used them this morning. I had 3 rotator cuff surgeries, each taking about an hour long. And the vest, I used one vest for 2 surgeries and then reloaded for the 3rd surgery with a new one. They stayed cold throughout the entire case. When I first imagined using the vest, I didn't really think it would make that much of a difference in terms of my concentration, because I figured I'd be concentrating the whole time during a surgery anyway. But I can tell you that it does really make you brighter, not necessarily smarter, but just a little bit more awake when your entire body is cool and fresh. I don't find there's any level of exhaustion when my core body temperature remains low, and it's nice to not sweat during a case when you're working hard. So the disposable surgeon's vest is really easy to use. It comes in 2 reusable cooling packs and a disposable vest. You simply slide the cooling packs into the disposable vest, and you can slide the vest over your head and then tie it around your waist. So really easy to apply. It happens to be the exact same color as my scrubs, so most people can't even tell that I'm wearing it if vanity is an issue. And it's extremely low profile and lightweight, so I don't feel there's any extra weight on my body whatsoever. It's form-fitting, so there's no binding on your shoulder motion as you're operating. As orthopedic surgeons, we're actively using our arms throughout the entire operation. As we've been trialing the surgeon's vest, I've been taking it into the OR, and every time I take it in, it's stolen by a surgeon. So somebody always wants to use it. The total joint surgeons love it because their cases often last longer than an hour. In total joint surgery, not only is the surgeon really actively using both arms, power tools, including saws, drills, hammers, to do the procedure, so it's a physical surgery. In addition, they're wearing a hood, a gown, a multi-layer surgical sterilization gown to keep them sterile throughout the procedure, and there's a lot of heat that builds up in that gown. So if they can stay cool, then that'll increase, like we mentioned previously, their concentration level, their energy level, and potentially their stamina throughout the surgery. I've also seen the nurses liking them. Today, one of my nurses asked me if she could have them. She was quite hot in the operating room, and she was pretty excited about it. She wore it the whole day. So hopefully, I think we'll see them take off. But just thus far in my experience, they've been kind of going off the shelf pretty fast.